Hi, my name is Wayne, and I've been here a month and 12 days. I've been getting a lot of help here.
My name is Karen. I've been a resident here for about a month at the shelter.
I'm Dwayne, and I am in housing.
There is a huge need for services in our community. Each year at the Delana Center, we serve almost 1,100 people experiencing homelessness. Many people have to wait, unfortunately, up to 8 weeks for a shelter. And one thing we've been seeing over the last few years is the medical, physical, disabled needs of those that we serve has increased drastically.
At the shelter, we're seeing a large increasing number of older adults with multiple acute and chronic conditions. A lot of times people who are homeless experience many of these conditions at a higher rate than those who are housed.
So when I was homeless, I checked myself in the hospital many times. So many times I can't even count them on my hand. My stroke, I'm still having problems getting back together. Being at the shelter did impact my life. It saved my life because I could have been out there and passed away. We have a lot of people out there. You don't see it until you get out there and you're in it. They have no beds. They're still outside homeless. You see them struggling every day. That's, waiting to get in or get a bed.
So the reason that I came to the Delanas was I knew it was a shelter. I didn't know that there wasn't going to be beds available. And I'm feeling worse and worse and worse, and I don't know what's going on with me. Shelby was at the front desk, and she said, I think you should go to the hospital. They knew that I was in that bad a shape because when I got to the hospital, they said I was in AFib. It was a terrifying moment. Well, there was still no vacancies at the time, so back to the woods. I slept in parks, under the shelter of the picnic table, whatever I could find. Well, by the grace of God, they called me later that evening and said that, they have a bed available, that I still want it. I was fortunate, and I was just really lucky. It was summertime, and that not everybody was seeking shelter when I was. Otherwise, I really don't think I would be here.
People like Dwayne, people like Karen, they were able to get the support that they needed. The experience they had would have been a lot better, and they would have been a lot more successful. They wouldn't have had to lament on the streets if we would have had a recuperative care shelter, which is first and foremost, a shelter, a place to rest and recover. It's an avenue to helping a person experiencing homelessness to get back into permanent housing, and then support to try to help them maintain and coordinate them maintaining that housing long term.
In a recuperative care center, I will act as the case manager who will get the clients housed. I will be working to find sustainable housing for them and make sure that they have the services that they need to stay in their housing and continue to manage their care. And our goal is to get them housed within 60 days from the Recuperative Care Program.
I'm going through the cancer right now, and they're giving me the best medical attention you can possibly think about, because they're giving it to you, 4 to 5 times a day. Doctor appointments, things like that, they helping setting that up. They have the best people for you to help you. I'm glad that it's such a program like this. I probably would have been just at the mercy of somebody. God just put me in the right place.
Wayne, he is from the Oakland Hope Recuperative Care Program. It's a center that we're modeling after to develop our own shelter association program specifically for older adults right here in Washtenaw County. The plan is to have 9 beds that the local hospitals can discharge and move people that are experiencing homelessness into, so that they don't have to be on the streets or they don't have to stay in the hospital. Those 9 beds are going to be here on the 2nd floor of the Delana Center. We have Packard Health on site already, so they're gonna have easy access to primary care health. What that's gonna do as well is give us more beds that our community desperately needs, specialized shelter beds, offering healing and immediate shelter for older adults, but also nursing care, patient education, training for self-management of conditions, and then work diligently to try to get them into housing and end homelessness once and for all in Washtenaw County. Please consider supporting the Shelter Association of Washtenaw County as we work toward our mission to end homelessness one person at a time.